live on Facebook. Now we're live on
TikTok it up. Okay, what's going on? Today we're talking about Graves' disease. If you're not familiar with it, it's considered to be like an autoimmune disease. It's hyperthyroidism. It's like your gas pedal is just pushed to the metal and your thyroid is just pumping out all day long. So we're going to talk about that today. So what's going on, Secoya Nation? Dr. Schilling, wilderness wisdom today. And Marco inspired me on this one. Name's changed for HIPAA reasons, but you get the idea. The point of it is he inspired me because his condition is interesting how it overlays in his life. And so when you look up people like Karen Robinson and people that have the typical sign of like, the only reason you really know if someone has Graves' disease is because they have exophthalmos. What is that? It's a fancy word for like one of your eyeballs or both of your eyeballs are basically a lot of pressure in the orbit and pushing the eyes out. So you can see more of their eyeball and it almost looks like they're bug-eyed, but it's not because they actually have a condition that's creating that. Our mission with bringing these little snippets is to help you understand the deeper meaning behind why would someone have a condition, because the condition is just somebody's name that was placed on it. So to that end, we want to show much appreciation to Marco for inspiring us with this. And also if you like us when we talk about these videos and you feel inspired to share them with your friends and family, please do so, because we're doing them for you. We want you to be informed and understand what's going on with people and not just look at them like, dang, what's up with that dude or that gal. It's like these people have stuff going on and you might be able to help them, whether it's your loved one or friend or family. So from a GNM, German medicine standpoint, we're thinking about like feeling like you're not fast enough to keep up with someone or keep up with a task or something like that. So your brain will upregulate the thyroid function. It's Graves is also called toxic goiter. If you don't know what a goiter is, it's like a swelling of the thyroid. Now, the number one reason for goiter in the world is like iodine deficiency, but that's from a medical standpoint. So, what goiter is like an enlargement, like your brain is just driving your thyroid, like whipping it like a mule you're using on the farm or something like that, and it just pushing. So, when you're not able to do things fast enough, or you're not fast enough to like save your own skin and stuff like that, that's what will drive from a brain-body disconnect the idea of Graves' disease. And so that's one option. Somewhere in the genealogy, you might have inherited this. Not like I have a disease that I inherited. Like people think about cancer is inherited, but it's like an idea of who went to the grave too fast. You can always share comments if you want, if you feel like they're appropriate. Yeah. So we appreciate all of you who comment and share your ideas with us. So just keep them coming. We might not get to all of them, but we'll appreciate them when we get them. So when you fail to manage your rhythms, when you're under enormous pressure, like how do I juggle, like a mom that has exophthalmos and Graves' disease might be trying to juggle all her work at home, all her work at her professional life. She might be trying to get the kids to this and that and the other thing, because in our society, for whatever reason, people seem to go crazy and trying to do so many things at one time, and their body's just getting worn down. So I would encourage you to back up and do about 80% of what you want to do every day. Think about your new motto being do less, because you're going to feel better and your body's going to last longer and be healthier when you do that. But if you are underestimated in terms of your power, like think of your thyroid as your voice. It's your power center, your ability to assert yourself. And so when you are being underestimated, or you feel like you're being underappreciated, that can drive the thyroid forward, if you will. Pardon me, water bottles. When you think of specifically of exophthalmos, think about the brain is pushing the eyeball forward because it wants to increase the visual field. So if you think if a person's eyes are set back in their head, they're going to have a less visual field, they'll have less peripheral vision. So someone with exophthalmos is going to be like pushing the eye forward so that they can actually see a wider visual field. So it's like I need to pay attention to either the prey, if I'm the predator, or vice versa, if I'm, because think about the thyroids start driving it faster, right? So you have to be out there like on the hunt. Or it could be, the alternative might be, a sunken eye might be like a prey, like staying back and things like that. So it just comes in different forms. So those are what I could find in research as far as the German medicine threads relating to Graves and its associated symptoms with exophthalmos, which is the most commonly associated symptom. So share your comments below if you think that's relevant for you or someone you love. Feel free to share. If you want this kind of content in your inbox, just send us an email, get on our email list and our newsletter list, because we'll send you this information in emails. Plus, information we can, you could use to support yourself and live your best life. Anything we want to comment on, share, fun?
What you doing on TikTok? The patients are waiting.
Great question. All our participants, which we call them participants, not patients, because patient means suffering, all our participants are done for the day, so here we are, not serving anyone, but we'll be serving people tomorrow. But thanks for asking. Anything else?
Not relevant.
Okay, cool.
Yeah.
All right, we love you all.
Next time.
Cool. We appreciate you all. Thanks for the comments, and we'll see you tomorrow for the Wellness Wisdom. All right, guys, have a good one.